Senator Alsobrooks.
Thank you so much, Mr. Chair, and congratulations to each of you on your nominations. This morning, I just have a few questions for Dr. Christine. Dr. Christine, you appeared on a podcast by 1819, and this was very recently in September of 2022, where you said the following, and I quote, "Society works best when men and women are fulfilling their roles, when they're doing what they're supposed to do, raising children and propagating the species. That fulfills the natural and moral law." Now, I have a question for you because I also know that Project 2025 calls for the Office of the Assistant Secretary for Health to focus on uplifting traditional gender roles. And so I want to know, Dr. Christine, I'm just curious, we have 8 women who are serving, for example, on this committee in the United States Senate, and I wonder whether it is your perspective that we are fulfilling our natural and moral roles working as senators instead of working in the home.
Senator Alsobrooks, thank you for being here. I'm sorry that we didn't have the opportunity to meet before this meeting, but thank you for your time today. So let me say that Project 2025, of course, I have nothing to do with that. I haven't even read through Project 2025. And of course, Project 2025 does not at all, in any way, shape, or form, dictate President Trump and his policy.
Yeah, let me just interrupt you, Dr. Christine, because I do have limited time. My specific question is just about your quote, where you said you believe in these traditional gender roles, and so I wanted to know, how do you specifically plan to use your office to uplift traditional gender roles?
Well, absolutely. My role as the Assistant Secretary for Health, if confirmed, will be to work with the Secretary to make America healthy again. I think in terms of gender roles, an individual, a man or a woman, can do what they want to do. My wife is an Oxford-trained, very high-caliber lawyer. We don't have children together. I support Helena in that. I support a woman's choice to go ahead and pursue any career she might want, or a man. But my main goal is going to be to make America healthier again by supporting Secretary Kennedy and supporting our president.
And I think this is a very important question. Again, this was not long ago where you said you believe that women and men are supposed to be in specific roles, raising children and propagating the species. And you would be, sir, really responsible as well for implementing policies that uplift health issues for women in the United States. And so I want to make sure that you understand that this is going to be very important to so many people. I want to ask you about another area, for example, regarding teen pregnancy, and whether you believe the teen pregnancy prevention programs are important.
Well, ma'am, I believe that I'm a biologist by training. I'm a scientist. I believe that young men and women should, when the age is appropriate, be educated about the biology and physiology of reproduction. I believe that when it comes to education regarding sexual intimacy, sexual intercourse, birth prevention, that is best in the purview of the parents. I strongly believe that.
So teen pregnancy programs, for example, Alabama has an adolescent pregnancy prevention branch, and I wonder whether or not you believe that this kind of program is important.
Again, I absolutely support that parents should be the individuals to discuss sexuality and those kinds of things.
No, I'm not asking you about parents. I'm asking you whether or not you believe that these kinds of government-supported programs, and specifically this teen prevention pregnancy program, is important.
Yes, I absolutely believe that that kind of education for kids comes from the parents best.
Okay, so you do not believe, for example, in the federal funding that would help to support an important program like a teen pregnancy prevention program. And I note your own state helped, for example, Alabama dramatically reduce its teen birth rate over the past 30 years by 78% by using a program like that one. But you are saying now that you believe that that kind of program should be eliminated. Is that what you believe?
Ma'am, what I believe is that as I support the Secretary to work to make America healthy again, we are going to do our utmost to make sure we pursue that agenda. We are certainly going to support the right of parents to make medical decisions.
Yeah, no, I know, Dr. Christine, I'm asking you about, not about parents. We're here talking about the federal government today and whether or not these kinds of programs deserve federal funding. And so I assume from your response that you do not support the federal funding that supported programs like the one in Alabama that helped to reduce teen pregnancy by 78%, but that you would agree with eliminating a program like that. Is that correct?
What I agree with is giving parents They have the major control of when they discuss these things with their children.
Okay, I yield. Thank you, Mr. Chair.